And at this point, I also want to address the issue of cancer. Now that I've mentioned it, there has been an outcry at Kenyatta University concerning the lack of Kenyatta University Referral Hospital concerning the lack of cancer drugs. I want to report to the country that that has now been resolved. It was a procurement issue because of lack of proper projection of stockouts. Now they have put in place, a system to know in advance what is required. Some suppliers have not been paid, but I want to report that now there is medicine at KUTRRH, Kenyatta University Referral Hospital, and also those patients who have not gotten medicine are being contacted and are being asked to go back there to get their cancer treatment, and that will be something that will manage properly going forward. The Primary Health Care Fund is also funded, or will be funded through the National Assembly allocations, but also through grants and donations, and it will be dedicated to purchasing a spectrum of essential healthcare services, and this includes promotive, preventive, curative, rehabilitative, palliative, and referral services. The Social Health Insurance Fund will pool funds to cover quality healthcare services for referrals from primary to higher level facilities. Contributions to these funds are designated for indigents. Those are can't pay, won't pay people. That is for the level 1, 2, and 3. Vulnerable persons, and there are many in society. And it could be you. Actually, you are just, many Kenyans are just one paycheck to poverty. So if you are not employed tomorrow, you may not be able to meet your medical bills. And that, I can tell you, is the reality of many Kenyans. Has also made significant strides in pursuit of a better healthcare environment, as we promised in the bottom-up economic transformation agenda plan. Key of them outlined below. For example, this is very, very important. The number of health facilities have been increased, these are public hospitals, from 13,841 to the current number of 14,532. 14,532, and this is a 5% increase. With our national bed capacity increasing by 14.8% to the current number to 109,020. This means at any given point. The other thing that also is very clear is that our CHPs, all of them, have smartphones. 100,017 already they have smartphones, and we have gone to places like Lamu, distributing them with the Minister for Health. We have been to Kwale, we've been to Kilifi, we were in Kericho, if you remember. So it is not, this is your story, this is stories at Jaba. Already those people have phones, so they can actually have contacts, they can take information, they can relay, and we are also using technology to even give feedback so that we know what are the prevalent conditions going forward. And it will be informed, very much wonderful, so that we get a lot of information in advance so that we can actually prevent some of these diseases, and also to promote well-being. So, and I really want to thank our governors because they are collaborating in this. They get a 10,000 shilling month stipend, 5,000 from the national government and 5,000 from the county government. So we really must appreciate that collaboration of the two tiers of government. And these funds will also help in terms of tracking information concerning health in all households in Kenya. It is also good to say that under the Linda Mama maternity program, the numbers have increased to 638,541, ladies and gentlemen. Further, for the last 16 months, ladies and gentlemen, the government has been able to increase job creation in the formal sector of the economy from 2.9 million, these are people who have a salary, to 3.1 million jobs. So you can see there is an increase of 200,000 jobs. This translates to 6.9% growth in job creation. So 200,000, 6.9% growth, with more jobs on the way, as the government hasn't entered into agreements for labor exchange with several foreign entities, including the recently advertised 2,500 positions for nurses in the Kingdom of Saudi Arabia. It is good to note that in the health sector, we have more than enough workforce, for example, to meet both our domestic and export labor. So the idea that people are saying, oh, if we export our nurses, are we going to remain with people, hospitals without nurses? No, that's not true. We have more than enough capacity, because one of the things that we have been doing, we do not link the courses at our various public institutions, but we train people and what the job market requires. So we are always getting a surplus of this, and even in our next briefing we'll give you the figures. How, for example, now our universities have got over 300,000 students, and every year over 100,000 graduates from those universities. So we have more than enough, and export labor has since then become a very important aspect of our foreign exchange earning. Last year alone, we earned 624 billion plus from these remittances, and we are the third country in the world that has received that kind of money. So you can see we have export labor, people bringing in the dollars, so that then we can, we can do well with our economy. The Enhanced National Social Security Fund (NSSF) savings have actually grown. Listen to this: from 1.4 billion shillings to the current 6.5 billion. And of course, therefore, it will also help in the facilitation of other national programs, and that has been happening for quite some time. Please remember that this Inua Jamii program is unconditional, grants, and also there is a component of health, so that then people can also benefit from the social health insurance fund. The other issue that I also want to touch here, and I need to put it very across, as a representative of persons with disabilities, is that the registration of persons with disabilities is now going to be done by directors of health in all the 47 counties, because earlier on it was being done here at the national level, and this will help a lot of unregistered persons with disabilities. The agony of traveling all the way from their villages when they have mobility difficulties, like wheelchair users, to seek verification and signing of their disability medical assessment reports by the National Director of Medical Services. In fact, we've been having a backlog at Afya House. So now that will be a thing of the past. It will be done in conjunction with the county governments, the Directors of Health. And then also, this centralized system of registration has really disadvantaged many persons with disabilities, and therefore denying them the benefits as per the law. Because the challenge there is, if you are registered, you can get tax exemption. If you are registered and you have a group, you can get a grant. If you are registered and you are a person with disability, you can get an education scholarship. If you are registered, you can also get an assistive device like a wheelchair, crutches. If you are registered, you can be given prescription glasses or sunscreen for those with albinism. So really, many now can actually benefit, because this data now will be properly captured by the National Council for Persons with Disabilities, which, as at now, after 20 years of existence, because it was started in October 2004, and I was privileged to be a pioneer board member there, only 580,000 people have been registered against the estimated number of 6 million Kenyans with various forms of disabilities. So this is really attributable to persons with disabilities who are eligible, shying away from registering, I beg your pardon, because of the long and arduous process, and the uptake therefore becomes very low, but now it's going to rise. So we are calling upon all persons with disabilities across the country, please go and register so that you can benefit from this. The process has also been shortened by the government's move of onboarding the disability registration services on the e-citizen platform as per the presidential directive. The online registration system is aimed at collecting accurate socioeconomic data for persons with disabilities right from the ward level. Eligible persons with disabilities can now register themselves from the comfort of their homes or smartphones, as long as they have a smartphone or a computer, and they have a signed health assessment report from the Director of Health at the county level, backed by a national identity card or birth certificate and passport size photos to be uploaded. The action saves the person with disability more time, as they need to travel to county headquarters for their services. Already, 3,091 submissions have been made through the eCitizen platform by persons with disabilities since activation in only 1 month. Cognizant of the possibility of reversing the gains that Kenya has made in promoting disability inclusion, the government will be in the next cycle of government performance contracting reinstate the disability mainstreaming performance indicator, which has been removed and retired from the performance contracting from all ministries, departments, and agencies. This is a very great gain because that is the one thing that was making all the ministries, departments, and agencies to have a program and action on persons with disabilities. Also, further to it, I am glad to report to the nation that the disability support allowance for all public servants with disabilities has been revised by the Salaries and Remuneration Commission to include more types and categories of persons with disabilities, such as those with low vision, including albinism, and those who draw print nearer to the eye, those who use 2 crutches or walking frames. So the government urges all employees within the public service to take note of this new development, because they'll be earning an extra 20,000 shillings for their personal aids, and for persons with disabilities who qualify, as enumerated above, to contact their relevant employer. So please, watu walemavu, now you have that, and we keep on reviewing this with the SRC. These are some of the things that we spoke about in the Disability Economic Charter under the Kenya Kwanza administration. The Ministry of Water and Sanitation and Irrigation has done a lot of good work in terms of, we have been able, as a government, to increase the area under irrigation by 6.7% from 664,000 acres to 711,933. This is an increase of 47.93%. The increase in rice production from 192,299 in 2002 to 234,000 metric tons is an increase of 47,933 metric tons, which is an increase of 22%. This is aimed to further reduce our rice consumption deficit and importation. Further, we have constructed 11 small dams and water pans across the country to harvest running water or runoff water for smallholder irrigation and in livestock use. So irrigation, livestock, and even home use. So there are small water dams and pans that have already been constructed since we came to power, and also the Thwake Dam. The other thing that we have also done is to increase the sewerage in urban places by 27%. So 27% was in 2022, but now it's at 32%. So you can see now there's an increase of 5%, and that is helping us to reduce the diseases in the various places in our urban centers, because you have sometimes running sewage getting into piped water. And it is in tandem with our commitment as Kenya Kwanza Manifesto, which is really aimed at empowering Kenyans and ensuring there is proper health care. And also, all of this is helping us to empower over 2 million farmers through the raising of the productivity value. The government remains dedicated to fostering positive change, and we are poised to continue with the momentum of economic revival, ensuring a brighter and healthier future for all Kenyans, as was promised by His Excellency the President. The government performance and service delivery roadshow will continue, and the report thereafter shall be presented to the National Executive Cabinet Retreat for further action in the month of February. I thank you.